Hi, I'm here to talk to you today about my plastic surgeon consultation that I had a couple weeks ago. I've been meaning to do this video for a while. It's been on my mind, it's been on my to-do list, but I just haven't felt good enough to do it lately. So I wanted to just tell you a little bit about how it went and some information that I found out. If you haven't seen my videos, my name is Melissa, and I am in the middle of fighting breast cancer. I have completed my 4th cycle of chemotherapy, and I had that about almost 2 weeks ago, about a week and a half ago. And I have 6 cycles that I will need to do total, and then my next stage to this will be surgery. So I have talked with my doctors, talked with my husband, looked up different information, and pretty much decided that I'm going to be getting a double mastectomy. The choices are you can get a lumpectomy, which is just taking out the tumor. You can get just a mastectomy in the breast that you have cancer in, or you could get a double mastectomy. I'm choosing to do the double mastectomy because I just feel like that's the best choice of not having to go through this process again, and I really don't ever want to do this again. So I'm not 100% sure, but probably 99% sure that that's what I'm going to be doing. So I did write some notes down. So lately with chemo, my brain has been not working up to 100%. I forget words a lot. I can't finish my sentences. It takes me a while to think of what I'm trying to say. I can picture it, but I can't say it. So I did write some notes down to help me. But when I got to the doctors, I first went in, and the first person to come in was a physician's assistant. And this doctor went over some different options with me. First, she talked about the choices of mastectomy versus lumpectomy. When she knew that I was leaning toward the mastectomy, she talked about how there was 3 choices from there. So the 3 choices are just to get the mastectomy with no reconstruction, which for me, I think would be really hard on me psychologically, and I don't think that's a choice for me. The other choice would be to get implants. And so for the implants, initially before I went to the appointment, I had done some research on silicone versus saline. And they had talked about how, and I was 90-something% of their patients they do with silicone now. Nowadays they've come a long way with the silicone, and they talked about how they do that because with the saline there's a lot of rippling with that, and so the silicone is just the better choice. However, it is a personal choice. There are pros and cons to both. I know one thing that I didn't like was, if the implants burst with the saline, it's just salty water and it will go into your system and you're fine. But with silicone, obviously, that can cause a lot of problems. And then another thing another thing with the implants was that there's pros and cons to getting implants as well. One of them being that one of the cons was that you would have to get them another surgery to get them replaced after 10 to 20 years. And since I'm so young, I probably would have to do that. So there was another choice, which is called flap surgery. And with flap surgery, what they do is take flaps of your skin, whatever part of your body that the doctor thinks is good. My stomach is an area that they did look at, but I've seen it done with, not seen it, but I've heard of it done with your belly, or it could be like flaps of skin on your butt, or even your thighs, your inner thigh or outer thigh. And they take those flaps of skin and they make breasts out of them. And so for me, I had heard of that, and I think that's probably the best choice for me. And some of the things that I learned there was that they will grow to the size of what my body, like if I gain weight, they'll stay, they'll grow bigger. If I lose weight, they'll be smaller. With implants, they just stay that one size. And so, if I end up gaining a bunch of weight, then it might look kind of awkward later. So, and also with the implants, they were talking about how there's about a 40 to 50% chance of infection. With the flap surgery, it's much less of a chance for infection. So that's what I'm leaning toward. However, I don't have to make the decision yet. It's actually much further away than I wanted it to be. So then she went on and talked about what would be happening during my surgery. I'm having it done in December. She talked about how there's two options after. So my other surgeon that I'm going to be meeting with in November is going to be performing the mastectomies, and then after that, my plastic surgeon would come in. And so there's two choices that you could potentially have after the mastectomies. You can have an immediate reconstruction, or you can have a delayed reconstruction. Of course, there's pros and cons to both. I was initially thinking that I wanted an immediate reconstruction. However, it really depends on just certain circumstances. And so one of my circumstances is that I do have cancer in my lymph nodes. And I do have a few questions for my surgeon about that process when I meet with her in November. So I don't fully understand that whole thing. And by the way, some of the information that I'm saying, this is all based on my understanding of what I've gone through, what I've been told. I could be wrong on some of it. So definitely, if you're wondering about some of the things I'm saying, look further into it. But this is my understanding of the process that I'm going to be going through. So because I have cancer in my lymph nodes, the chemo hopefully will be killing that. However, we're not sure until surgery. From my understanding, the surgeon will be the one to determine whether I have a full lymph node dissection or a partial. So that's a little bit still I'm trying to figure out. However, I more than likely will probably have radiation on my lymph nodes. So when you have radiation, that would have to be done before any kind of reconstructive surgery. So I wouldn't be able to do the immediate reconstructive surgery if I'm going to be having radiation. So they kind of went over, for me, I'm a planner, and I just wanted to know like the process of like what's coming first, what's coming next. So basically it's the surgery, and then since I won't be able to have the immediate reconstruction, what they're going to do is put in spacers. And so they showed me what the spacers look like. They look like what I would imagine implants looking like unfilled. And so they're going to be putting those in. And so then I'm going to be going back once a week, and they're going to be filling them with water. to stretch my skin. So you go back, they said anywhere 4 to 8 times to get the certain size to stretch my skin. And so the spacers can be left in there until my reconstructive surgery. And so that's the next, so then after that surgery, then I'll be having radiation more than likely. Based on my pathology of after surgery of the tumor and different, the lymph node tumor also, that will determine what my next step is. So immunotherapy was what they had told me before, but it could possibly be something different. I don't really know until then. And then after that, then I can have my reconstructive surgery. So in my mind, as I'm sitting there, I met with a physician's assistant. She went over all this, and then I met with the surgeon. He pretty much went over the same things, but told me a little bit more information. He did talk to me about how long I'd be in the hospital. It's only going to be overnight, one night. And he just explained the process a little bit more. Talked about how I'm going to have 2 drains. And so the first one will come out about a week after surgery, and then the next one will come out about a week after that. So I just had more of a clearer picture of what I was going to be doing. However, they did tell me those steps, but they didn't really give me a timeline. So after I left, they did give me some information, some papers to read over. So I did, and I found out that I can't have the reconstructive surgery until 6 months after radiation is done. So that kind of put a little bit of stress on me, because that's going to bring me to the summer, possibly next year. I'm a teacher. Really was hoping to get done with this whole process by July. They said it would be about a year process. But I think it's more looking like it's going to be a little bit longer than that. So I'm not really sure when I will have the reconstructive surgery, but they did say that I could leave the spacers in for up to a year. So it could be this time next year that I'm having the reconstructive surgery. I've taken a little time to process that, and I think that it's going to be okay. But like I said, I'm a planner, and I was hoping to be done by July. Don't think that's going to be happening, but like everyone keeps telling me, it's my health that's the most important thing, and it really is. But I really just want to get back to my normal life. So anyway, that was my visit. And just one thing that I've learned through this whole process, if I look back to the beginning, is that it's so different than what I thought it was going to be. And the next step is often based on the previous step, like, the findings of the pathology that will determine what my next step is. So I didn't really realize that before, but just I'm trying to be patient, trying to take day by day, and just look at getting through this first step. This first step is chemo. I'm really excited that I only have 2 more left. I'm getting really, really tired of it, and I'm noticing that I'm getting different symptoms, which I will be talking about in another video about my 4th chemo. So you'll see more about that, but it's just some days I'm super discouraged, and thankful for the good days like today. So thank you for watching. If you have any other questions, put them in the comments, and I'll try to answer them. I'm not an expert, but I am learning a lot. So thank you for watching, and please share and like my videos.